One more question I always get is at what level of antibodies or what antibodies test we should do if patient is diagnosed with hypothyroidism?
Okay. So whenever you find a patient with thyroid disorder, 99% of thyroid disorders is due to antibody. So hypothyroidism, we have two antibody. One is anti-TPO. That's a new name for old anti-microsomal antibody. That is positive in 80 to 95% of the patient with Hashimoto. Second antibody is anti-thyroglobulin, which is positive in 50 to 80%. So whenever you find a patient with TSH more than 4.5, you do antibody first. Actually do both antibodies first, because 80% one may be positive, 20% another may be positive. So you maybe think that antibody both doing, you have to spend 500 rupees or more than 550 rupees for that. Nothing. It is worthwhile. Number one, you are telling the patient your thyroid is not due to iodine, cabbage, cauliflower, broccoli. It is due to nothing but thyroid. Number second, you are proving the patient it's an autoimmune disease, so it is going to be permanent in 90%. Number third, autoimmune thyroiditis of Hashimoto has high HLA association. You have to screen your first degree latest also. Number four, the autoimmune Hashimoto may be associated with autoimmune type 1 diabetes, adrenal insufficiency, or a celiac disease, pernicious anemia, or a hypoparathyroidism. So antibody you are doing only once to prove that it's a Hashimoto thyroiditis. Antibody titer is never important except in postpartum thyroiditis. Postpartum thyroiditis, the higher antibody shows that there's a higher factor of progression to overt hypothyroidism. After iodization, 27% of Indian people after puberty have antibody positive. So antibody just shows that the patient is having higher chance of Hashimoto. You follow with TSH.
Yes, sir.